In this video, you're going to learn one new exercise to strengthen your deep hip external rotator muscles. That's also great for improving your hip stability and for sacroiliac joint pain, and it may also help with sciatica. Coach E for Precision Movement, and welcome to another video where we're going to take you through a new exercise to target a neglected area of your body, and that area is the deep hip external rotator muscles. And that's kind of what we specialize in, is targeting the neglected areas of the body, because we find that once we get these neglected areas working well, a lot of pain and dysfunction that people experience goes away, because these are areas that are just forgotten and people don't know how to train them. So I've come up with unique exercises like the one we're about to go through today, and I've got almost 300 of them in our ROM Coach app. I just checked before this video. So if you want to learn more new exercises to target these neglected areas of your body, make sure you have the ROM Coach app. We'll have a link up here and down in the description below. The muscles we're targeting today are known as the deep hip external rotators. And it's a group of 6 muscles, including the obturator internus and externus, the gemellus inferior and superior, the quadratus femoris, and the one that most people have heard of before, the piriformis. Now, while these muscles are known to contribute to the movement of hip external rotation, which is on this leg, externally rotating the hip looks like that, or if I'm standing on this leg, externally rotating the hip looks like that. They contribute to that movement. They're also important, and possibly more important, for hip joint stability. And I found a study outlining this. The title of the study is Architecture of the Short External Rotator Muscles of the Hip. And the key findings from the study are that these muscles have relatively small individual physiological cross-sectional areas, short fiber lengths, and low pennation angles. That's the angle of the muscle fibers. The large collective PCSA and short fiber lengths of the gemelli and obturators suggest that they primarily play a stabilizing role rather than a joint rotating role. Now, in practice, hip joint stability, I look at it in 2 different ways. One is keeping your hips stable as you're standing on it, so it's not rocking all over the place when you're trying to balance on one leg. 2, there's something I call dynamic stability, or hip joint centration. And that's keeping the head of the femur, this is the femur, the thigh bone, and this is it right here, the head of the femur, this is the head, centered in the socket as you move around. And that's important to avoid problems like femoroacetabular impingement, FAI, sciatica, and just general hip joint pain from movement that is not stable, where the head of the femur, that bone, is sloshing around in the joint and bashing on different structures, and bumping into different structures, resulting in tissue injury, inflammation, and pain. That being said, let's get to the exercise today. The setup for this exercise is very important. There are 2 key components. One is activation of the deep muscles of the foot, so those intrinsic foot muscles, with an exercise that I've taught on this channel so many times called the short and skinny foot. And basically, that's where you contract the muscles of the bottom of the foot to make your foot short, so pulling the foot from the forefoot towards the heel, and skinny right across the metatarsals here. You're not curling your toes doing this. You're pulling the bottom here, the metatarsals, towards the heel and making it skinny across that area. So I've got other videos, we'll link to them up above and down below, that will help you to focus on that specific component first if you don't know how to do it. So short and skinny foot, that's number 1. Number 2 is pelvic floor, which I just talked about. Pelvic floor activation. Now if you can't do it, no worries. Continue doing the exercise anyway. But if you can, basically it's, imagine you're peeing, stop the pee midstream, and think of pulling everything in towards the pelvis. So those 2 things are part of the setup. So I'm gonna do that right now, short and skinny foot on, I'm gonna work this leg, I'm gonna stand on this leg, and then pelvic floor activation. I'm stopping pee midstream. I'm gonna stand on one foot, and this is very slow. First, I'm gonna externally rotate on this hip. This is closed chain, external rotation, as far as I can. And I feel lots of activation through the glutes and also deep in through the pelvis. And then I'm gonna slowly externally rotate as much as I can on this leg. So I'm out wide. And then I'm gonna shift my weight over slowly, keeping the external rotation here, transfer my weight, lift my other foot, and then I'm gonna slowly control the rotation back to standing. And then I go to 2 feet. I relax, and then I'm gonna go in the other direction. So here, short and skinny foot, pelvic floor activation. I call it foot and floor activation. And then stand on my 1 foot, my left foot here. I'm gonna externally rotate on the left, externally rotate on the right, keeping everything contracted. Slowly shift my weight over here. All my weight's on my right now. I'm gonna lift up my left, and I could pause there for a second to make sure everything's on, and then slowly control it back to the standing position. And then I let everything go gradually. So that is the exercise. You go back and forth, and you're working both open and closed chain external rotation on both hips. We're getting that integration between the foot and the feet and the pelvic floor, and we're getting good stability and activation all through the lower body. So it's a very simple exercise, and it's related to another exercise that's really popular here on YouTube because it's so good at helping with SI joint pain. And we'll link that one up here and down below. It's a similar exercise, but this one incorporates the rotational component, which for anybody who's active in sports, you need that hip rotation. You need that balance on one leg to operate at peak performance. To start off, I suggest you just do 3 to 5 repetitions on each side, going back and forth. You do 1 set and see how you feel. If you have pain, test your pain out before. Do the exercise, test your pain out after. Walk around, see how it feels. If you have SI joint pain, I guarantee you'll feel better after doing this exercise. So there you have it, another new technique to keep you moving freely and without pain. Love to know what you think. Leave me a comment down below. Make sure you're subscribed to the channel, and some other resources for you. We've got the old SI joint pain video that's very popular right here. We've got an external rotator, hip external rotator video right here. And most importantly, get the ROM Coach app. We're making improvements to it and adding content to it all the time. So you'll want to be there to make sure that you're connected to your body to move freely and without pain for the rest of your life.